You know what bothers me about this whole situation the most? Jealousy. Because for myself, trying to become a professional athlete and knowing what a high ankle sprain feels like as a doctor, this is a tough injury. We're talking usually participants are out 6 to 8 weeks because it's different than a traditional lower ankle injury. This isn't a higher grade injury, it's higher location. So it's a different anatomy. The injury on a high ankle sprain is actually the injury of the ligament that is between your tibia and your fibula, which are the two bones that make up your lower leg. And there's a connection there that gets sprained or torn in this injury that is very painful. A lot of people can't even weight bear 2 weeks in. I've had an injury just like this, and I was out for 4 to 6 weeks from even just walking. And to see Patrick Mahomes last week be able to do as well as he did and have an MVP style performance is really impressive because it's not what I would expect as a physician seeing his injury the previous week before.
So here's my question for you. Having played on that injury, just a week later, what would your course of rehabilitation be for him? Would you have him full participation in practice already? I mean, they have the weekend off this weekend. How would you have gone about this injury?
It's difficult to know because I would need more intricate details of how his body is healing, where exactly the injury is occurring. But I'll tell you this. I promise, despite being cleared for full participation in practice, they're not pushing him. Because pushing it too far, making those drastic cuts and all that improvisation that Patrick Mahomes likes to do in the pocket is not really feasible with an injury like this. So while he may be going through the motions, doing the plays, doing the routes, practicing with his receivers, he is not pushing 100% because if you were to push 100%, come Super Bowl time, he's not going to be able to get maximal performance. So I know that despite being in full participation mode, he's not pushing it 100% in these practices.
Yeah, you always wonder how teams are going to handle these situations. Who knows with the Chiefs? They could be saying he's full participation when he's really not, just to kind of throw off the Eagles on the other side, because that will deviate their game plan and make them
Dude,
prepare.
I would throw away. I would throw anything at the Eagles at this point. If they're getting 70 sacks in the regular season, I would be scared if I'm Patrick Mahomes, given that I have a high ankle sprain. You're not going to be able to be as mobile as you'd like to be in the pocket. So I would play as many games and mind games as possible here.
Well, I've had high ankle sprains before. To your point, they're awful. They're miserable. Just taking a step is pretty terrible. I want to talk about someone that you interviewed recently on your show, Brandon Marshall, who had a very similar injury, that high ankle sprain. Had a pretty crazy conversation with you there, but managed to suck it up and score 3 touchdowns from a maybe treatment protocol that maybe you found to be
Yeah,
questionable at best.
I hate to see people get over medicated when it comes to professional sports, and we've seen that be a problem historically. And Brandon Marshall was very open and honest on my podcast, The Checkup, talking about his experiences here. He talked about a Sunday night football game where he had a high ankle sprain. The team was about to rule him out. He said, "No, give me a chance to do the warm-ups." And before doing the warm-ups, he said he took 4 pain pills. He didn't say which pain pills they were. I'm going to make my own assumptions on that one. And then some Toradol pills as well, which is a non-steroidal anti-inflammatory, similar to the Motrins, Aleve of the world. And he said when he came out, he felt great. He was able to score those 3 touchdowns. But we're saying that, we're laughing, we're smiling. We're pointing it out, showing the danger that young folks in the league, the ones that may be really excited to play and get their first opportunity to take the field during the Super Bowl, take medications, do these things that are actually putting their body at risk for the future. And I am, again, not saying this at all that Patrick Mahomes is going to do this. In fact, I would hope he's not doing this. And to my, I guess, pleasant surprise, I heard that for the previous game against the Bengals, that he didn't have to actually take an injection. And that makes me happy because that means his body is healing well.
Yeah, that's unbelievable to think, especially given the timeline. But that's what I want to ask you about, because obviously, if there was ever a game to play through the pain, to suck it up, even if you are going to damage your injury just a little bit worse, it's clearly the Super Bowl. Say this ankle is in pretty bad shape. Maybe he does go the shot route, the medicated route. What kind of long-term damage might we be looking at later? And, would that kind of damage be something he could get through before the start of next season? Or could this potentially come to something that might hamper him throughout the rest of his career?
Yeah, when it comes to a high ankle sprain, again, you're talking about that bone on bone connection. And if you fully tear that weakened ligament, you can get into a situation where you're going for surgery and recovery can be up to 6 months or even longer. And then who knows how well you come back and do the whole rehab process. So it's something that we obviously never want to see in our athletes. We never want to push them to come back too soon. And the important difference here is between the locations of a lower ankle sprain and a high ankle sprain. A low ankle sprain, you can tape up that ankle. You could limit its mobility. But on a high ankle sprain, taping it and giving it more stability can actually cause more pain, more symptoms. In fact, the test that we do for this in order to make the diagnosis for a high ankle sprain is putting pressure and squeezing the two shin bones together. And imagine if that hurts so much that we can do it on a physical exam, what's going to happen with a person who's taping it up like that to play in a game? It's a lot of pain, a lot of pressure on that ligament, and that's where my biggest worry comes from.